Hi, my name is Rachel Ackerley. Today I will be discussing AFAF-Millais transition theory in relation to the nurse's role in transition care of patients receiving chemotherapy. Nurses are often caregivers of patients and families as they are going through different transitions. They also may prepare patients for impending transitions and facilitate the process of learning new skills related to these transitions. Examples of transitions for patients undergoing chemotherapy involve a new diagnosis of cancer in many situations. This is a change in their health illness continuum in which a person is going from a place of wellness to one of sickness. The patient may be dealing with many comorbidities, as well as surgery and radiation related to the cancer, as well as chemotherapy. They may be recovering or in rehab from surgery they had received, such as receiving a mastectomy, having to deal with drains, or a colostomy, where they now have to learn how to take care of their colostomy, or the same with the nephrostomy tube. That is a lot to deal with at once. They may also be starting radiation at the same time as chemotherapy and may have to be dealing with side effects related to that, including skin changes, nausea, vomiting, and of course, fatigue. There may also be some developmental changes as they're going through treatment, including a change in fertility. Some people may not be able to ovulate with the chemotherapy. Some may go into menopause, which is a change in development, including all the side effects and hormones and changes that go along with that. And some may lose the ability of having children in their lifetime due to infertility. They may also be going through different aging concerns, dealing with a chronic illness, as sometimes cancer can be, as well as dealing with fears about death and dying. They can also be experiencing changes in their roles. For example, roles of being the caregiver of the family, being the breadwinner of the family. They may have to change the amount of time that they work. They may be too tired to take care of the children. There might also be social economic impacts, including a change in salary, a change in their support system through their work. There could be cultural influences, and these all need to be assessed. Transitions can be complex and happen many at a time. There can be multiple transitions all at once, and they need to be addressed simultaneously. Nurses need to consider these patterns in all the transitions that are going on at one time in a person's life, which can be very, very complex. Are these changes sequential? Are they overlapping? Are they simultaneously? What is the nature of the relationship between these events that trigger the transitions? If there are many happening at once, most of the time there usually are, the stress level can be quite high and the patient can really be in distress. When a person is in transition, they need to be aware that the change is occurring. Nurses should understand that the level of engagement, how much does the patient understand? What is their knowledge for the chemotherapy? Do they have experiences with family members? Had they had cancer before? How quickly has the diagnosis happened? Did they go into the emergency room because they had chest pain only to find out they had lung cancer that's wrapped around their heart? This might be something that's more traumatic and stressful for the patient than having a small lump that they've been watching and have anticipating that something may come as a result of that. And how are they diagnosing with, how are they feeling about the diagnosis? What is their psychosocial status of that? How are they coping with these changes? Because transitions are a result of changes that result over time. They usually start at the beginning before a change has happened until the end period. Nurses need to understand what the meaning of the transition is for the person. What is their perception? What is their expectation about what's going to happen with their treatment? Let's say they start treatment for breast cancer. Are they anticipating that this is going to be curative? Do they understand that they're palliating or just trying to decrease pain. And so it's important to understand what that is. Transitions involve critical turning points of events. And in this population, it might be restaging of disease. They've had chemotherapy, they're having a restaging. Does that mean they continue on? Have they progressed? Do they need to change to new treatments? Did it not work? Are they now going to need to transition to palliative or hospice care? Or is it stable and they're going to move on to maintenance treatment? What will that involve? How will that change their roles? What choices do they have? What do they need to do with that? And each critical point requires nursing knowledge and expertise to help teach and to help them through these periods. For example, if they're starting new treatment, teaching about side effects and how to manage them, such as mouth sores, diarrhea, fatigue, and even at the completion of chemotherapy. This also is a transition because a patient might feel anxious. They've had the clinical team all this time and now they're finished and no more doctor's appointments, and they've losing that support of the caregivers and the team. And that leaves the patient feeling uncertain. They may feel vulnerable at this time as they transition to a survivorship role. Nurses need to understand that the environment and the person facilitate or hinder progress towards achieving a healthy transition. Is there a personal meaning to the patient that's preventing them or from moving through a healthy transition? Are there cultural beliefs that are preventing them from having a positive outcome? In certain types of care, such as certain cultures, women don't talk about their breasts and keep them covered, and as a result, they don't receive the care that they need, or they won't discuss the side effects if it's talking about like a genital urinal system. Are there socioeconomic systems that are concerned? Can they not afford treatment? Chemotherapy may be very expensive, especially oral medications. Have they had a loss in their job? Have they lost their insurance because they're unable to work because of chemotherapy treatments? Do they have other expenses that they can't afford the supportive medications that help prevent the nausea and vomiting and will prevent them from completing their care? Do they have any community support? Are they utilizing visiting nurses? Will they allow them into their homes? In certain cultures also, the families, the people who take care of the patients, they do not let outsiders in. What is the shape of their home? What support systems are in place? And some people don't like that stereotype of having other people in their house. Has someone given them negative advice? Are there societal barriers, such as positions in the family? They have to continue to work because they have insurance for the entire families. So all of that has to come to play. The nurse can provide therapeutic nursing interventions to care for the patients that are in transitions, and this is usually done through building relationships with the patient or family or community. And you want to provide culturally sensitive care also. And the nurse will mobilize support systems for the patients. Do they have caregivers at home that are helping them? Does the person need to learn self-care? Do they need assistance? Are they accepting, as we discussed earlier, the VNA, physical therapy, helping a patient find support groups that'll help educate them, psychosocial support systems, and do they need to meet with a financial navigator that will help with those types of transitions? And then identifying milestones are essential for example, if someone is in their first chemotherapy, they're in their nadir. During that period of time, it is important for the nurse to support that patient and develop interventions that will help produce a healthy outcome for that patient during that milestone as they're going through their treatment. Also, debriefing at the end of treatment allows the patient to recount their story, is a tool used to help a patient come to terms with the transition experience that they have had through the roles that they have changed. It can also be used to identify some psychosocial issues and additional needs in the long term as they enter survivorship or as they enter hospice, and also clarifying roles. This can be used to help patients understand what is expected of them. Example, you set the goal of self-care so they can manage their side effects and take care of themselves. If they have a caregiver, this allows that caregiver to then take care of themselves and the stress that can happen when you're a caregiver. The nurse's role is to help the patient complete a healthy transition and develop confidence in coping and mastery of the transition using resourcefulness and have a positive sense of well-being as they go through these transitions and roles. Afaf-Meleis transition theory, the concept and propositions include, according to Smith and Parker, the transition provides a framework to describe the experience of individuals who are confronting, living with, and coping with an event, a situation, or a stage in growth and development that require new skills, sentiments, goals, behaviors, or functions. Meleis defined transitions as a passage from one life phase, condition, or status to another. Transitions are complex and multidimensional. They have patterns of multiplicity and complexity. The major assumptions of the theories include a human being's responses are shaped by interactions with significant others and reference groups. Change to health and illness events and situations trigger a process that begins at or before and extends beyond the event in time. Whether aware or not aware, individuals and families experience process triggered by changes with varied responses and outcomes. Outcomes of changes with varied responses are shaped by the nature of the experience. Preventative therapeutic actions can influence these outcomes. Individuals have the capacity to learn and to enact new roles that are influenced by their environment. Gender, race, culture, heritage, sexual orientation, all shape people's experiences and outcomes of health, illness events, as well as health care that's provided. The meta paradigm, including nursing, the nursing perspective is defined by humanism, holism, health, well-being, goals, and caring. The nurse is the primary caregiver for the person that's experiencing the transition. The theory is based on this nurse-patient relationship at a time of vulnerability and transition. The person is the person, of course, that's going through the transition. It's a process of movement and change and fundamental patterns of life. The health is transitions are complex and multidimensional, and they flow and move over time. The environment is where the transition is happening, the experiences and the interactions and the conditions, including the physical, social, cultural, organizational, and societal influences of experiences, interventions, and outcomes. Individuals and families and communities are all patterns in the care process. What happens within this transition theory, that change triggers a developmental, situational, health, illness, and organizational, which was discussed with that first slide. Those changes move a person. It's a triggering event, and the transition changes are characterized by properties such as time span, process, disconnectedness, awareness, and critical points along the way. The changes also initiate a process with patterns of responses that can occur that are both observable and not observable behaviors and are either functional or dysfunctional in nature. These include personal, community, society, and global conditions. How the individuals an organization's respond to the change of events and outcome patterns. Process patterns and outcome patterns include mastery, fluid integration, identities, resourcefulness, and healthy interactions. The goal of nursing interactions within this theory is to facilitate and inspire healthy responses to the process and outcomes. Some of these are through clarifying meanings, setting goals, modeling the roles of others, providing resources, opportunities for rehearsal and debriefing, which we discussed in the previous slide. Applications of this theory in my current practice are many. As I've mentioned before, I'm part of the oncology care model, which is a value-based quality model, in which part of that is improving transitions of care between the office and emergency room or inpatient, transitions to nursing home, group home, or in the community in their own home, using improved communication and better transitions of care to help patients have better outcomes and can lead to better quality of life in these patients. So there are many applications with this theory. Thank you.